everyone, today I will be presenting a case study called I is Right. So in this case study we are introduced to a Mrs. S who's in her 60s and suffered from a massive stroke that affected the deep and dorsal portions of her right cerebral hemisphere. So after suffering from this stroke, Mrs. S displays her preserved intelligence and humor, but she can't see through her left visual field. Sometimes Mrs. S would complain about missing items on her food tray, but when nurses tell her that the item is on her left, she doesn't quite understand what they say. She also only eats the right half of her food, then complains that the food portions are too small. Sometimes she only applies makeup to the right half of her face and leaving the left side completely neglected. So these behaviors show that Mrs. S has totally lost the idea of left in regard to the world and in her own body. Although this syndrome mostly affects the visual perception, neglect and other forms of perception could also be found. So when Mrs. S was given a video screen as a mirror, she was able to see both sides of her face, but what's interesting is that she did not have any sensation in the left side of her face or her body. So a stroke affecting the right parietal lobe of the brain could lead to neglect on the left side of the visual field, and this causes the patient to have neglect behave as if the left side of the sensory space is non-existent, although they could turn in that direction or move in that direction. Hemi-inattention syndrome is a disorder in which the patient does not respond to anything unilaterally and is typically on the left side. It is notable that this is an attentional phenomenon. These patients could walk normally, although they are not aware that their left leg is present. Interestingly, if someone were to put the patient's left hand on their right hand, they would say that the left hand belonged to someone else. These patients think that their neglected limbs are left where they were last before they had the life-altering stroke or brain injury. Hemi-inattention or hemispatial neglect is often produced by massive strokes, such as here in the case of Mrs. S, or in brain unilateral injuries in the right parietal lobe, specifically in the region of the inferior parietal lobe, which is labeled here in the red in this diagram. It is at the intersection between the temporal lobe and the parietal lobe, and it's just behind the postcentral gyrus, which is where the primary somatosensory cortex is located. So right-handed spatial neglect, on the other hand, is rare because there's redundant processing of the right space by both the left and right cerebral hemispheres, whereas in most left-dominant brains, the left space is only processed by the right cerebral hemisphere. Mrs. S presents a more extreme case of hemi-inattention as displayed with not having any sensation in the left half of her face and body, only eating the right half of her food, and applying makeup only to the right side of her face and completely neglecting the contralesional left side of her face. Methods of diagnosis include computer simulations, identifying midpoints of respective lines, and drawings or replications of symmetrical shapes and objects. The individual's marking and drawing are used to observe the areas the patients perceive visual information from versus areas of spatial neglection. While some patients have unilateral neglect, as we've been talking about, others could have object-based neglect, in which once the individual is focused on an object, half of the object disappears. Priming studies are also used to show that information is being processed in the neglected side, and it can influence subsequent behavior, but it is the individuals that do not give it any attention. Okay, this concludes my presentation for this case study on hemi-inattention syndrome. Thank you so much for watching.